In the summer of 1865, in a heavily guarded room inside a Vienna mental asylum, a 47-year-old Hungarian doctor lay dying. His name was Ignaz Semmelweis. 2 weeks earlier, his own friends and his own wife had tricked him into walking through the doors of this place. When he realized what they had done, he tried to escape. The guards beat him severely. They tied him in a straitjacket. They poured cold water over him. They forced castor oil down his throat. And somewhere in that violence, a wound opened on his right hand. Within 14 days, that wound became infected. The infection spread through his bloodstream. And on August 13th, 1865, Ignaz Semmelweis died, alone, in a place built to hold people who had lost their minds. The cause of death recorded on his autopsy was pyemia, sepsis, bloodstream infection, the exact disease that Ignaz Semmelweis had spent his entire adult life trying to prevent. The man who had discovered how to save millions of lives was killed by the same invisible killer he had been screaming about for 18 years. And everyone around him, every single doctor, every single colleague, every single member of his own profession had called him crazy until the moment he died. This is his story, and by the time you finish hearing it, you will understand one of the darkest truths in the history of human civilization. We had the answer for 4,800 years, and we still could not see it. To understand how a Hungarian doctor ended up dead in an asylum, we have to go back to a hospital in Vienna in the year 1846. Ignaz Semmelweis was 28 years old. He had just been appointed as a junior assistant at the Vienna General Hospital, one of the largest and most prestigious medical institutions in Europe. His job was to work in the maternity ward, where women came to give birth. And what he found there was a slaughter. The Vienna General Hospital had 2 separate maternity clinics. The first clinic was staffed by male doctors and medical students. The second clinic was staffed by female midwives. They delivered the same babies, in the same building, in the same city, but the numbers were impossible. In the first clinic, the mortality rate for new mothers was 18.27%. In some months, it climbed above 30%. In the second clinic, the mortality rate was only 2 to 3%. Women were dying in the doctor's clinic at 3 to 5 times the rate of the midwife's clinic. And the women of Vienna knew it. Women in labor begged on their knees not to be sent to the first clinic. Some of them, when forced through the doors, would turn around, walk back into the street, and deliberately give birth on the cobblestones outside the hospital, in the rain, in the dirt, with no help and no medicine. And here is the most terrifying fact of all. The women who gave birth on the street had a lower mortality rate than the women who gave birth inside the doctor's clinic. Something inside that clinic was killing them, and no one knew what it was. Semmelweis became obsessed with the mystery. He measured everything. He ruled out overcrowding. He ruled out diet. He ruled out the climate. He ruled out religious anxiety. He ruled out lactation. He ruled out every single theory the medical community of 1846 believed in. Nothing explained the difference. And then, in March of 1847, the answer came at the cost of a life. His close friend, a fellow doctor named Jakob Kolečka, was performing a routine autopsy when a medical student accidentally cut his finger with a contaminated scalpel. Within days, Kolečka was dead, and when Semmelweis examined his friend's body, he saw something that froze him. The symptoms of Kolečka's death were identical to the symptoms of the women dying in the maternity ward. Identical. The same fever, the same swelling, the same sepsis, the same death. And in that moment, Ignaz Semmelweis understood. The doctors and the medical students were performing autopsies on diseased corpses in the morning. Then, without washing their hands, they were walking directly into the delivery room and putting those same hands inside laboring women. They were carrying death from the dead to the living. They were the killers. In May of 1847, Semmelweis instituted a new rule. Every doctor and every student in the first clinic was now required to wash their hands in a solution of chlorinated lime before touching any patient. The results were almost unbelievable. In May, the mortality rate had been 12.2%. By June, it had crashed to 2.2%. By July, it was 1.2%, for the first time in the history of the hospital. Semmelweis had cut maternal death by 90%, not with a drug, not with a surgery, not with a machine, with soap and water and a basin of chlorinated lime. He had just made one of the most important discoveries in the entire history of medicine, and the medical world responded by destroying him. Because here is what Semmelweis did not understand. He had not just discovered hand-washing. He had told every doctor in Europe that they were the killers, that every funeral, every grieving husband, every motherless child of the last 100 years had been the doctor's fault. And in 1847, that was unthinkable. Doctors were gentlemen. Gentlemen's hands were always clean. The medical establishment did not investigate his findings. They did not run new studies. They did not test the chlorinated lime in other hospitals. They simply rejected him. They mocked him. They manipulated mortality data to make his numbers look false. They blacklisted him from medical journals. In 1849, they forced him out of the Vienna General Hospital entirely. He returned to his home country of Hungary and took a job at the St. Rochus Hospital in Budapest, where an outbreak of childbed fever was raging. Within months, his methods reduced the mortality rate there to 0.85%. To understand the full horror of what happened to Semmelweis, you have to understand something almost no one in America knows. He was not the first person to discover that washing could save lives. Humans had known this for 4,800 years. The oldest soap in the history of the world was made in ancient Babylon, in approximately 2,800 BC. Archaeologists in 1935 unearthed clay tablets from this period, containing the world's first recorded soap recipe. The instructions read, "Combine 1 part uhulu, which was potash made from burnt barley straw, with 3 parts oil from cypress trees, and mix when the moon is full." The chemical reaction that produces soap, called saponification, is the earliest recorded chemical reaction in all of human history. We have been making soap since before the pyramids, since before written language as we know it, since before the wheel was common across the ancient world. The Babylonians used it to clean wool. The Sumerian priests used it to purify themselves before sacred rites. And most extraordinarily of all, ancient Babylonian medical texts show that they understood soap as a sanitizer for wound care and infection prevention. 4,000 years before germ theory was discovered, the people of ancient Mesopotamia knew that soap could prevent infection in a wound. They knew, and the knowledge was forgotten. The Egyptians had soap by 1500 BC. The Ebers Papyrus describes a mixture of animal and vegetable oils combined with alkaline salts, used for both cleansing and medicine. Then the Romans came, and the Romans did something strange. They rejected body soap. The Roman elite cleaned themselves not with soap, but with olive oil, which they scraped off their skin with a curved metal tool called a strigil. The Roman writer Pliny the Elder called soap an invention of the Gauls, the barbarian tribes of what is now France. To Pliny, soap was beneath the dignity of a civilized Roman. The Latin word for soap, sapo, comes from an ancient legend. There was said to be a mountain near Rome, called Mount Sapo, where animals were sacrificed to the gods. When it rained, water washed the melted animal fat and the wood ash from the sacrificial fires down the slope of the mountain into the Tiber River. Women washing clothes downstream noticed that the soapy clay in the river made their fabric cleaner. The word soap was born from a hill of dead animals and ash. Then Rome fell, and Europe entered the darkest hygienic age in human history. By the year 1250, the Catholic Church had declared bathing itself to be a moral danger. Pope Innocent IV issued a verdict against Emperor Frederick II, calling him a heathen. The first accusation on the official list was that the emperor bathed every single day. St. Francis of Assisi taught his followers that an unwashed body was a stinking badge of piety. Queen Elizabeth I of England bathed once a month, and she was considered an obsessive cleanliness fanatic. King Louis XIII of France was not bathed even once until he was 7 years old. The medical establishment of Europe taught that water and bathing opened the pores of the body, allowing disease to enter. The wealthy class began wiping themselves with cloth soaked in wine or vinegar. They covered the smell of their unwashed bodies with perfume. Ignaz Semmelweis died of pyemia, septic blood poisoning, gangrenous osteomyelitis of the middle finger of his right hand, and a metastatic abscess that had spread into his chest. The man who had spent his life trying to stop sepsis from killing women was killed by sepsis. His own autopsy was performed in the same building where he had once performed autopsies on his own patients. He was 47 years old. He was buried in Vienna in August of 1865. Almost no one attended his funeral. He died believing he had failed. But here is what no one knew on the day he was buried. Less than 5 years later, a French chemist named Louis Pasteur would publish his germ theory of disease, proving that invisible microorganisms cause infection. The same year Semmelweis died, an English surgeon named Joseph Lister was already experimenting with carbolic acid to disinfect surgical wounds, building directly on what Semmelweis had discovered. Within 15 years of his death, every major hospital in Europe and America had adopted hand-washing as a basic medical practice. Every life saved by every surgeon in the world, every clean delivery room, every sterile operating theater, every washed pair of hands in every emergency room on Earth today exists because of what Ignaz Semmelweis discovered in a hospital in Vienna in May of 1847. The conservative estimate is that hand-washing in hospitals has saved more human lives than every vaccine, every antibiotic, and every surgery combined. Hundreds of millions of lives, possibly billions, all from one Hungarian doctor in a chlorinated lime basin. Today, there is a psychological term used by scientists, by doctors, and by historians. It is called the Semmelweis reflex. It describes the instinctive, automatic, emotional rejection of new evidence that contradicts what we already believe to be true. Every human being has it. Every culture has it. Every institution has it. And every time someone in history has tried to tell the world something it was not ready to hear, the Semmelweis reflex has done its work. The messenger has been mocked. The messenger has been silenced. The messenger has sometimes been beaten to death in an asylum, and the truth has had to wait, sometimes decades, sometimes centuries, sometimes thousands of years. Before the world was ready to hear it, humanity had soap for 4,800 years before we listened to a Hungarian doctor about washing our hands. The knowledge was there. The chemistry was there. The clay tablets were buried under the sand of Mesopotamia, waiting to be found. The Babylonians knew. The Sumerians knew. The Egyptians knew. The Gauls knew. And we forgot. We banned bathhouses. We declared cleanliness a sin. We let queens go a month between baths. We let kings die unwashed. We let children die in the arms of unwashed doctors. And when a man finally screamed the truth at us, we beat him to death and let him bleed out in a straitjacket. He was right. They called him crazy. He saved millions of lives that will never know his name. And tonight, every time you wash your hands, You are doing what he died trying to teach us. His name was Ignaz Semmelweis. He was 47 when he died. And now, you know the truth.